welcome to Health Talk. I'm your host, Jill Fraley-Dotson. Of course, Health Talk, a service of Pikeville Medical Center, a time we get together to discuss prevalent issues concerning the medical field in our community and services offered at Pikeville Medical Center. My guest today, first-time guest, Dr. Cody Reynolds, Pikeville Medical Center emergency physician. Dr. Reynolds, welcome to Health Talk.
Thanks for having me. Nice to be here.
We are really excited to have you here today because we're going to talk about something that is very common in our area. It's a sport that a lot of people take advantage of and love to get in the hills. That's ATV riding. Today our topic is going to be ATV safety. But before we get into the meat of the show, let's talk a little bit about you. Tell us a little bit about yourself.
Sure. My name's Cody Reynolds. I'm an emergency physician at Pikeville Medical Center. Grew up in the county, so I'm from Phelps. So pretty pertaining to know a lot about the ATV accidents for a lot growing up. We take care of all these injuries when they first present to the emergency department, so I'm pretty keen with everything that goes on as far as that goes.
So being from our region, you certainly your entire life have known about ATVs
Sure.
and the thrill that people get from riding them and how fun it can be. But on the flip side of that, it can also be extremely dangerous, and there are certain precautions that everyone needs to take when riding ATVs. Let's talk a little bit about the most common ATV-related accidents that you see in the ER.
Sure. Studies have shown most common accidents are going to be injuries to the top portion of the body, the head and the arms. Most of the time people are getting thrown off of ATVs. So the first thing that everybody wants to do is put an arm out to try and hold themselves up. See lots of lacerations due to ATV accidents, see lots of abrasions and things, but it's about equal distribution between injuries to the head and neck, and then to the upper extremities and then body and lower extremities come thereafter.
Do you think that ATV traumas are on the rise in our area?
I think that since just looking at studies and things, it's from about 2005 to about 2006, we're starting to see a decline in the amount of ATV injuries, but we're actually starting to see a rise in the amount of ATV accidents in our area. Partly because I think that people are starting to take advantage of the mountainous terrain and the kind of the opportunities that we provide here in the mountains and some of the trails that are opening up. So we're seeing a shift nationally and throughout the United States that is a decrease in ATV accidents, but here locally we're starting to see an increase in the amount.
Certainly. How severe, we talked about the types of injuries, you talked about the upper part of the torso and to the head, but how severe are the injuries that you're seeing? Are they minor injuries to the more extreme?
Yeah. At Pikeville, I mean, we're a regional transfer center. We see, just in the area, we see lots of smaller injuries and things, but we're also getting large, we're getting traumas that are being flown into us from scenes. We're taking traumas from other areas and things. It varies, and it really just has to do with, just how they're riding the ATV, like what kind of things that they're trying to do, or are they following like safety advice? It just varies. It could be from from minor injuries, lacerations, cuts to very serious traumatic injuries.
What do your potential patients need to know about these injuries? Because I'm sure that they come into the ER, they could be extreme, like you said, or minor, but there's certain things that they need to know about the importance of taking care of themselves after an injury.
Yeah, absolutely. And it's so subjective. I mean, emergency to one person is not emergency to the next. And if you feel like you need to be evaluated by an emergency physician, we absolutely 100% want to see you in the emergency department because that's what we're there for. According to as far as like of what you would need to know about certain injuries, it's just according to which body part that you injure. A traumatic brain injury is going to be a lot different than an injury to an arm. If you have an obvious deformity in the arm, we want to see you. If you fall off and hit your head and you lose consciousness, or you're having like vomiting and you're concerned, then we want to see you in the emergency department. If you have an injury and you're concerned, then we want to be there for you.
Absolutely. Good thing that you mentioned if you hit your head, especially. Some people think that might not be a big deal if they're out in the woods and they're riding their ATV and they fall off. But then later on, the vomiting comes, the dizziness comes. So it's very important they get to the emergency room as soon as possible.
I think so, especially in older individuals and things. And especially men, who's going to be the riders of ATVs primarily, we tend to put things off. Especially men from these areas. Some things that they should be concerned about as far as traumatic brain injuries go, and some things that we look for in the emergency department that would warrant imaging If you lose consciousness, if you hit your head, if you have sustained headaches that just aren't, responding to things that they're supposed to respond to, if you have like intractable vomiting, if you have vomiting that just doesn't feel normal for you, those are some things that we would want to be able to take care of in the emergency department, things that you should be concerned about, or your family members should be able to notice, hey, he doesn't look normal, he's not acting normal, this is not his normal self, then we won't be able to see
I think about blurred vision too. I mean, you can usually tell if somebody's had a traumatic brain injury or a concussion at least, you can tell in their eyes that there's something not quite right.
I think so 100%, yeah.
Let's talk about some preventative measures that people can take with ATVs. And you mentioned a lot of people from our area don't want to do it, but the importance of taking precautions when you're riding an ATV is of the utmost importance.
Absolutely. Yeah. So some things that you can break it down into what adults need to do and then what kids to do. The American Academy of Pediatrics don't even want anybody younger than 16 years old on an ATV. And if they're going to be on an ATV, if you have kids that are going to be on ATVs, they really need to be supervised. Protective gear is of the utmost importance. 100%, like everybody that's on an ATV needs to be wearing a helmet. It's easy to fall off, it's easy to be thrown off, it's easy to be struck by something while you're driving, and you have to protect your head. Other things, just decreasing the amount of alcohol that's intaked while you're on these ATVs, just paying attention to your surroundings, paying attention to other people that's there. Don't have ATVs on pavement, out on the paved roads. We're seeing a humongous increase in the amount of people that are having injuries driving on paved roads because all-terrain vehicles aren't made for driving on paved roads, so we're seeing an increase in that. So some things to think about.
You do see a lot of that, and unfortunately, if you're driving along US 23 or US 119, or especially even our side roads, our two-lane roads, it's very troubling when you see an ATV coming at you. Number one, with no one wearing a helmet, and the next thing is if they have children. Small children on their ATV. We're going to get to that in just a moment. But certainly helmets are crucial to wearing when you're riding an ATV and can prevent a traumatic brain injury.
Absolutely. Something so simple can cause to prevent a lot of these serious injuries.
As parents, I just mentioned children, it can be very tempting to let your child ride an ATV or operate an ATV. You think they've been around them for a long time, or small children, you think as a parent, I can hold them on. But really that's not something that we want to do.
Not at all, and we see that quite a bit. And a lot of things that you'll see is the parents have the kids on the ATV with them, and they're going to be the first ones to get thrown off. I mean, because adrenaline takes over, you get scared, you hold on, they're not onto you, and they get thrown off. And then kids operating ATVs, these are made for adults, and a lot of these pack a lot of power, and their little bodies and their strength is just not really capable of handling a machine with that capacity.
As a physician, what would you want to tell parents about allowing their children underage to ride an ATV?
Right. And I know it's really common to the area. I grew up on ATVs. All my friends grew up on ATVs, but I've seen a lot of my friends have some pretty serious injuries. One of my friends had to be flown out when we were in grade school from a pretty serious traumatic brain injury. No kids under the age of 6 or 7 need to be operating. Even the smaller ones, if they're just not ready, they just don't have the motor coordination. They're just not ready for having that kind of responsibility. If you're going to have your kids on with you, they need to be wearing the proper safety device. You don't need to be having them out with you while you're using the alcohol. Just really, honestly, just common sense. Just doing things that just if you really just think about the situation, things that you just you don't want to have kids out on ATVs and have serious injury.
It's easy to give in as a parent when they want to try something so bad, but I think it's also important to explain to them how dangerous it can be, and that they will be able to do it when the time is right and when they're of age.
Yeah, and it's hard when they're it's just like anything else. They see their friends, they have the ATVs, or their friends are riding, and they want to do the same thing too. So,
how do the injuries to children differ from that of adults? I know you said adults, it's the upper torso, but I would think children being so much smaller, the injuries could be a little bit different.
Yeah, they can. And then just like we talked about earlier, and the head injuries as well, and the mass and the amount of body space that the head takes up on a child is a little bit different from an adult, because their heads are just so much larger than the rest of their body in proportion. You see a lot of head injuries in kids. As far as the types of injuries, though, the severity, it seems to be a little bit more increased in kids. We see, a little bit more serious ATV accidents when the kids actually do have an ATV accident. They tend to be just a little bit more serious in children. We seem to see about the same kind of distribution of injuries, a little more to the head and neck area than the extremities, but a little more serious in children.
We've talked a lot about precautions, safety gear, chest pads even, helmets, and that sort of thing. What are the main recommendations that you have for someone who thinks that they're larger than life sometimes and they can do anything going up our mountainous terrain? And of course, like you said, with the trails and everything opening up, sometimes we think that we're larger than life, but what is the one thing you want them to know?
Wear a helmet. Yeah, 100% wear a helmet. Like that's the one thing that can save your life. If you don't have a helmet on and you get into just a minor altercation, if you fall off, the terrain here, it's rocky, it's mountainous, like anything can happen. Something as simple as just you hitting your head can cause some serious mortality.
Certainly. So as we come to a close today, I want to ask how prepared is Pikeville Medical Center in dealing with the care and responding to adults and children after an ATV accident?
Sure, we can take care of anything. If you have an injury, if your family has an injury, no matter what it is, we're going to be able to take care of at least the initial staging of the things. We have 3 very capable trauma surgeons. We have a plethora of emergency board certified physicians in our ER department. We have all the specialties that are going to be involved in all of your care. If you have an ATV accident and you're injured, we want to see you at Pikeville Medical Center.
Let's recap one more time. If you're out riding your ATV, hopefully you're not on the highway because they're not made for pavement. We've talked about them being made for rough terrain. But if you were to sustain an injury, if you were to fall off, if you were to flip backwards, what are some of the signs, one more time, that we need to look for to make sure you get to the ER? Gotcha.
So, just talking about traumatic brain injuries. So, if talking about it, if you're in care of a loved one, if your loved one loses consciousness, if your loved one, something we call altered mental status, if they're just not acting normal, if they're having a harder time responding to questions, or they're just not, saying things that you seem appropriate. If they're having multiple episodes of vomiting, that just doesn't seem to kind of fit the bill. If they weren't sick earlier and they hit their head and then they start to vomit. Those are the kind of things that we would be concerned about with the traumatic brain injury. Obvious swelling to an extremity, if it looks broken, if they're having a lot of redness, a lot of swelling, a lot of pain, then we want to see those sorts of things.
Certainly, too, internal injuries that you can't see. Exactly. But if you're having pain in your torso, maybe in your abdomen, certainly in your extremities, but make sure that you seek medical care. It's better to be safe than sorry, 100%, right?
100%, yeah. Something that we see when we start having the ATV injury season, handlebar injuries, a handlebar to the stomach seems really trivial, but it can cause some really significant injuries. So if your child has a blunt trauma to the abdomen, or you sustain a blunt trauma to the abdomen, chest, anything like that, if you're having pain, if you're concerned, we're concerned, so we want to evaluate you.
Certainly. So like I said, be better safe than sorry.
100%, yeah, especially if it comes to you or your child.
Absolutely. Dr. Cody Reynolds, emergency room physician at Pikeville Medical Center, your team does a great job. We have people there that will certainly be able to take care of any injury that you have to make you comfortable, and also to remind you how to take care of yourself after an injury, and certainly would refer if they need to see anyone else within Pikeville Medical Center. Most important thing that you say, wear a helmet.
Wear a helmet, yep. Take care of your head.
Keep the kids off of it.
Absolutely.
And keep them in the mountains.
Yes.
Off the roadway.
Yes. Stay off the road. A lot less things can happen to you out there. Keep them where they're supposed to be.
Absolutely.
Right.
Dr. Cody Reynolds, emergency room physician, Pikeville Medical Center. Thanks for joining us for Health Talk today.
Thanks for having me.
This has been Health Talk, a service of Pikeville Medical Center. I'm your host, Jill Fraley Dotson. Pikeville Medical Center, proud member of the Mayo Clinic Care Network.